Good day, colleagues. I am Dr. Hope NWOGA, and I'll be presenting on the effects of COVID-19 on doctor-patient relationship in a tertiary health facility in Enugu State, Southeast Nigeria. By way of introduction, the doctor-patient relationship have been linked to patient satisfaction, treatment adherence, and it remains the cornerstone of medical practice, which may be affected in this era of COVID-19 pandemic. Patients are physically and emotionally separated from their doctors due to use of personal protective equipment, telemedicine, and patient fear of accessing health care. To provide the patient with high quality care, there needs to be a healthy doctor-patient relationship. Communication and trust are the key elements among the other factors in building a healthy relationship. Effective communication has always been one of the ingredients of in all fields of work. Having a good communication skill is considered a ladder to success, whether in the field of economy or medicine. The objective of this study was to determine the effect of COVID-19 pandemic on the doctor-patient relationship. The study was a cross-sectional study conducted in a tertiary health facility in Enugu State, Southeast Nigeria. It involved all the doctors working in the hospital at the time of the data collection. Patients that attended the general outpatient clinic of the hospital were selected using convenience sampling. 186 doctors and 155 patients participated in the study. A similarly structured self-administered questionnaire was used to collect data from both the doctors and the patients. This is the result. Table 1 shows the result of the socio-demographic characteristics of the doctors. Table 2 shows the socio-demographic characteristics of the patients. About half of the doctors were aged 40 to 49 years. Majority were males and married. Half of them had worked for 11 to 20 years. For the patients, about half of them were aged 30 to 39 years. Majority were females and married. The figure we are seeing shows the doctor-patient relationship as reported by the doctors. The same questionnaire, similarly structured questionnaire was used for both the doctors and the patient, as we have said before. From this chart, we can see that most of the doctors still take time to listen to their patients, talk to their patients, still show empathy. But the most striking thing here is that when it comes to physical examination, most of the doctors agree that they do not take enough time again to do physical examination on their patients in this era of COVID-19. And some of them also are admitted, 52.7% of them also admitted that social distancing practice has affected their relationship with their patients. But the chart shows the results of as reported by the patients. When we look at the chart, we can see some disparities between the reports of the doctors and that of the patients. But the most striking one here is on physical examination. Most of the patients also reported that the doctors do not still do physical examination on them, as only 11.6% of them agree that the doctors still do physical examination on them. And then another striking thing is the social distancing practice, which 91.6%, almost all the patients say it has affected their relationship with their doctors. I've explained this. By way of discussion, the doctor-patient relationship is built on communication between the doctor and the patient. This communication comes in form of medical interview, which gives way for proper diagnosis and treatment. This communication can be verbal or non-verbal. In this study, only a minor proportion agree that their doctors still take time to listen and talk to them in this era of COVID-19. Without effective communication, trust cannot be built, and it is this trust that determines to a large extent the treatment outcomes. Studies have shown that the quality of treatment relationship is found to shape patient outcomes more strongly than the specific techniques applied. Majority of the doctors asserted that they still take time to have eye contact with their patients and show empathy. For the patient response differ, as only about half of them, 56.8%, agree that their doctors still have eye contact with them, while a minor proportion agree that their doctors still show them empathy. This shows a gap in the non-verbal aspect of the doctor-patient relationship. Studies have shown that in primary care, knowing the patient is at least as important as knowing the disease. And physicians with a warm and friendly style are more effective than physicians with a more formal style. Patient satisfaction, treatment adherence, and treatment outcome have been found to be associated with doctor-patient relationship. Empathy has been described as the key feature in all relationships. A very minor proportion of the doctors agree that they still do thorough physical examination on their patients, 11.8%. And this was collaborated by the patients, as about 11.6% of them agree to that. This shows the gap created by the COVID-19 pandemic. Physical examination creates bond and trust between the doctor and the patient and helps in diagnosis. Studies have shown that about 10% of diagnoses can be made with physical examination. About 64% of the doctors reported to still bother about their patient satisfaction with their consultation, while only 33.5% of patients agree to this. Patient satisfaction with the doctor has been shown to affect compliance to medications and use of health facilities. About half of the doctors agree that the social distancing practice have affected their relationship with their patients, while almost all the patients, 91.6%, asserted that the social distancing have affected their relationship with their doctors. This is not surprising, as the increase in the use of personal protective equipment, both by the doctors and their patients, make it difficult for good emotional and non-verbal communication between the doctors and their patients, and this has been shown to create a gap in doctor-patient relationship. About 68.4% of the patients believe that the doctors intentionally prolong the appointment time in order to keep them away for longer periods. Almost the same proportion of patients also agree that they intentionally miss the appointments in this era of COVID-19. Even though the present COVID-19 pandemic have affected certain aspects of the doctor-patient relationship, the patients still have faith in their doctors and vice versa. This may show an understanding on the part of the patient that the change in the doctor's attitude was not meant for harm, but for the good of both the patient, the doctor, and the community at large. In conclusion, the present COVID-19 pandemic have affected the doctor-patient relationship adversely. These are our references. Thank you for listening and stay safe.